When you or a loved one is diagnosed with Parkinson's disease, you're probably going to have a lot of questions. What is the best method of treatment? What are the best therapies to use? Your doctor is going to make a lot of recommendations, and physical therapy may be one of them. And you may have a lot of questions as to how is physical therapy going to help me or help my loved one. And so hopefully in this video, we will be able to tell you a little bit about how physical therapy can make a big impact for someone who has Parkinson's disease. Hi, my name is Allison Schmidt, and I am a licensed physical therapist at EW Motion Therapy in Birmingham, Alabama. Today I want to review with you why physical therapy is good for patients with Parkinson's disease and just what you can expect when you come into the clinic for evaluation and treatment. Parkinson's disease is a progressive neurological disorder that can lead to a variety of movement dysfunctions. You can see things like difficulty with walking, very, very short steps that can lead to a shuffling gait. You can see difficulty getting in and out of a chair, getting in and out of a car, even getting in and out of bed. So this can really impact somebody's daily life and just how they move about their environment. And so the goal of physical therapy is to be able to help you figure out how to navigate your environment safely and independently. And really, there's been a ton of research that shows that exercise is one of the few things that can actually slow down the progression of Parkinson's disease. And so that's where we want to get involved as soon as we can. As soon as we know we have a diagnosis, we want to initiate physical therapy and get a consistent exercise program going so that we can slow the progression and keep you as independent and safe as we can. So when you come to the clinic for your initial evaluation, the first thing that's going to happen is we're going to sit down and we're going to have a conversation. We're going to find out about your medical history, any recent surgeries you've had, any difficulties that you've had since you've been diagnosed. We are going to discuss your medications because if you are taking medications for Parkinson's disease, the timing of that medication can really affect your ability to move and how well you move. So we're going to want to know about that schedule that you're using for your medications at home. And then we're going to want to find out what a day-to-day is like for you so that we can make your day-to-day easier and keep you doing the things that you want to do. Once we have had that initial conversation, then we're going to watch you move. We're going to watch you walk. We're going to watch you get up from a chair. We're going to see how you navigate the environment so we can provide strategies and tactics to help that be easier, but also provide ways to get you stronger so that you don't necessarily need to have assistance, or you can feel confident in getting about your environment day to day. And so once we've completed that initial evaluation and that initial plan of care, your subsequent visits are going to be doing exercises and activities to help work toward those goals. And so that could look like just general lower extremity strengthening, doing a lot of walking laps where we're cueing you for appropriate step length or appropriate arm swing, very specific balance exercises on uneven surfaces or with narrow base of support to mimic your environment, practicing going up and down stairs if you have stairs in your home. So we are going to tailor each treatment session to you and what your needs are based off of what we find in that evaluation. At the end of your first session, the therapist is going to provide you with a home exercise program so that you're able to continue practicing the strategies and the exercises that you've learned in your session so you can continue to get better outside of the clinic. Click the link in our description below for a few examples of exercises that some of our therapists have assigned as part of home exercise programs for our patients with Parkinson's. If you wish to try any of these exercises on your own, just make sure you're doing it safely after you've discussed it with your doctor, and make sure you have someone there to supervise.
If you found this video helpful, be sure to give it a thumbs up and don't forget to subscribe to our YouTube channel to help you on your physical therapy and wellness journey.